This episode contains sensitive topics, so please make sure to take care of yourself while you're listening. Take a break if you need to, walk away, whatever you need to do. Please just look after yourself is the most important thing. Welcome to Like-Minded with Dr. Patrice. Each episode, we'll be sitting down with different types of experts and unpacking the intersection of mental health, pop culture, and our day-to-day lives. My name is Dr. Patrice Lagoy. I'm an international psychologist, licensed marriage and family therapist, and former entertainment executive. This episode, we will be discussing the perinatal experience for survivors of childhood sexual abuse and how people can navigate their mental health needs throughout. My guest today is Ebony Williams, licensed marriage and family therapist and founder of Cactus in Bloom. Ebony is a Black, queer, first-generation woman who's also a licensed marriage and family therapist, social emotional healing arts instructor, and a trauma-informed yoga teacher. Ebony is a trauma specialist who practices LGBTQIA+ affirming and culturally humble therapy. She has worked with children and families, adults, trauma survivors, and folks across the spectrum of mental health, identity, and experience. She is the founder of Cactus in Bloom, where she conducts research, training, and consultation, and provides direct service support to support childhood sexual abuse survivors throughout the reproductive and parenting journey. Welcome, Ebony. Thank you for joining me.
Thank you for having me.
So I'd like if you could tell us a little bit about Cactus in Bloom, the purpose of the organization, and how you realized that there was an unmet need for the services that you provide.
Yeah. Where to start? So before I had kids myself, I have been working in trauma recovery centers, working with survivors of sexual assault, sex trafficking, DV, IPV, childhood sexual abuse. So really kind of my day-to-day has been in supporting folks who are navigating life, with what it means to kind of heal from a trauma that is not at all of their own making, right?
Yes.
And so how do they do that? Oftentimes, how do they do that? And parent. And so, I had seen it from that lens. I had also seen that there was not always the support available for them. So the agencies I, was in had great supports for them. But when it came to referral outside, there was high cost, there was limited access. And so, for example, I, became a trauma-informed yoga instructor because the next steps for many of the folks I worked with was how to get the body engaged.
Yes.
But $24 for a yoga class was not accessible.
That's right.
And so I decided to do it myself so that I could heal on my own level, but also then bring that to folks who needed access to that.
Yeah, and I think that access can be such a barrier, having the resources available, having the money to pay for that, right? And just feeling that you can be open enough to receive it, right? Even if once you take care of all those barriers. Talk to me a little bit about when you say trauma-informed, what does that mean?
Yeah, so trauma-informed on a foundational level is just walking in to any space knowing and assuming, right? So this is the one area where we want to assume that at least
the one
area that at least one person in the room has experienced a trauma. And so then it becomes a requirement to act accordingly.
Okay.
And so what that looks like is when we think about trauma, some believe trauma is universal, that our first traumatic experience was birth. And so if that's the case, along with knowing that we have layers of trauma. So, for example, COVID was a trauma. It was a social trauma that we experienced. I grew up in New York. I was in Manhattan during 9/11. That's a trauma I live with, right? We're not always going to know what everyone's trauma is, but we know the kind of foundational experiences that we have shared collectively.
Yes.
So with that, then that means I need to operate and structure a space so that everybody in the room can feel contained, especially those who have experienced trauma. So when I am operating in that way, I am serving everybody.
Yes.
And so that, thinking about trauma-informed tenets, the principles of trauma-informed tenets, some of them include transparency and making sure that you establish as much space for safety. And that can look like making sure that there's accessible water for folks, right? Or a snack, because maybe that's the first time they've eaten that day.
Yes.
If you say you're going to do something, following through and doing it, right? So these are some of the tenets of a trauma-informed practice.
Yes.
So, I mean, thinking about like even how Cactus and Bloom came about, knowing that there is a need, there's a need to create often what is not there.
Yes.
And then having worked with many CSA survivors, many SA survivors who have been pregnant or parenting, although that was not my initial in for working with them, it was mostly through their trauma experience, and it just so happened that they were in these different moments of their life. But there's a lot of navigation of that. And then myself as a CSA survivor, and then becoming
just for everyone,
a parent,
childhood sexual abuse,
and SA sexual assault and SV sexual violence. With my own experience, having done my own healing work, but then having children. And realizing as I parallel worked with clients, like, where's the support?
Right. And as you alluded to, parenting in and of itself is a challenge. It's a challenge.
It's a
wonderful challenge, right? And we're never bored. But what were you seeing uniquely come up for people who are survivors of childhood sexual abuse, like through the perinatal process? What did you notice that the other kinds of services that were being provided were not meeting the needs?
Well, even if we start with first the examinations that happen during that process, right? There is often little assessment that's even done to ask folks. And medical professionals are actually in a great position to do these assessments, to ask, hey, do you have a history of any trauma, right? And that could be anything. But making sure to incorporate bodily intrusion and experiences of sexual violence, right? Because then actually it should be a practice for everyone. But then you're more so aware of resources that some folks might need. You're able to be mindful of ways in which that you can access, like, what do you specifically need, right? What would help you? And then you're more attuned to narrating every single thing that you're doing and making sure you're asking for consent. Now, these should be across the board.
So important.
But they're often not done, right? So intrusive exams are done without asking for consent and rushing through it when someone might need to slow down because maybe they're having something come up for them.
That's right.
Right.
Yes.
And so I noticed that. I also the lack of assessment, and then the care to go with that. And then on top of that, perinatal courses do not actually prepare folks for what may show up for them in birthing. And we know, CSA folks have a higher rate of re-traumatization in birth and have higher rates of traumatic birth, right? But then what do you do with that?
Yes, right. And I do think that sometimes when people are not, there's not the time taken to figure out what is happening for someone. It can come across to medical professionals like there's resistance. Why aren't they coming to their doctor's appointment? It's because it's too traumatic and you're not taking the time to see what the issue is and what resources are available to them, right? And so it can lead even to people not doing their regular checkups and that kind of thing because it's too painful.
Oh, 100%. And I've heard this from residents themselves who are wondering, why are folks not showing up, right? And so the why is, in part, everyone is in a bind, right? So you've got this restriction oftentimes to have 15-minute appointments. And you got to rush through that because you got to get to the next person. And then you have the person who's trying to come in to make sure that they're well, but they might be experiencing so many symptoms show up for them a week before they even walk into that room, right? And so oftentimes with folks that I've worked with, they would get nightmares before they came to sessions because they knew they walk into that door, here's what this space is about. And so there's so much need for everyone, all of us, to slow down and to create space. And to say, okay, well, I may not be the person who can sit with you for an hour or 2 hours or help you walk through this, but let's get you to someone who can.
Okay.
And then let's start preparing you. So one of the missing links in all this is the perinatal course that doesn't fully prepare folks for what they can expect. Now, nothing can prepare you 100% for parenting.
That is factual.
Nothing. Once you have that kid, you got to keep them alive and feed them and all the things. And
every
it's
day,
pressure.
every day.
It's a lot. But something can actually like start to get you having a conversation about what is your postpartum plan?
Yes.
You know, who are the care people in your life who you're going to call on because the rate of help seeking is low when you've experienced such early trauma.
Yes.
You know, how do we make sure that the person who is your support person understands the signs so that they can advocate for you if you can't ask for help?
Yes.
And how do we normalize the conversation so that folks actually know, okay, well, I'm having this thought, and this thought may be like, oh, I fear I'm going to hurt my child. But that thought is a result of what has happened to you.
Yes.
And so how do we normalize it so that you can talk about it and not hold that?
Yes. Without all of the stigma that goes around it, right? I think that sometimes people think, okay, well, you gave birth, you have this healthy child, you should be over the moon. And it doesn't leave a lot of space for anything that is not just pure joy and excitement at having this baby, right? And so I think that, you know, to your point about normalizing that and saying, like, this doesn't make you a bad person. There are things that have happened to you, and it is actually the normal thing is for this to come up for you here, right?
Yes.
And, like, how do we talk about that? And how do we, you know, I appreciated how you're talking about the kind of wraparound of services, your support, your partner, you know, whoever that is, friends, your medical professionals, everyone needing to kind of recognize that this is something that is not currently happening. And it has very serious consequences that it's not happening. You know, we talked about people not going to their appointments. And then that way, you know, there's something that you need care, the baby needs care. Maybe those are things that are being missed, but it's just so difficult to get to those appointments when you know you have 15 minutes. Someone's not going to ask you what's going on with you. They're going to do something that might feel like another violation of your body, right? How do you work with medical professionals to kind of recognize the importance of what you're trying to teach people?
I think first, what I'm finding in talking to medical professionals, to mental health practitioners, because this is an issue in mental health as well, right? Where I would often get a call from someone who'd been working with their client for years. And finally, their client felt safe enough to disclose that they had been abused early in childhood. And then the call that I would get would be like, can you see them now?
Oh.
And this was because they didn't feel equipped well enough to support their client, right? Which sends many messages, which is, it's too much to deal with what you've disclosed. Keep it quiet. Go somewhere else.
That's right. And that just builds on those feelings that person was already having by the time they've shared that with their therapist. They've run through this conversation in their head, and that can then feel like a rejection.
Yes.
Oh, I knew it was too much. They can't handle it. They don't want to deal with me anymore, right?
Yes.
And it's interesting probably for you and, you know, for me to like see, well, it's good when a therapist realizes they're in over their heads, right? Yeah, that's good. Don't be out of your scope of practice, right? But how is that communicated to clients? How is that received? And how can therapists work on their knowledge so that doesn't happen? Because I'm sure that feels like a rejection to the clients.
Yeah. And, you know, what is the likelihood they're going to go to someone else?
Yes.
Right. And build that all over again and get to that point that took them years in the first place. Right. And so it is about, yes, not working out of your scope, but expanding your scope.
Yes.
Right. How do you get that additional education, that training? And here is where we come in.
Yes.
Right. And we, you know, really aim to work with anybody who touches the life of someone who's going to then be another person in this world, because our ultimate goal is to interrupt the intergenerational cycle of childhood sexual abuse and sexual violence, because there's so many parts of the system that perpetuate children continuing to being harmed.
Talk to me a little bit about that, what you've seen about the parts of the system that perpetuate it.
Yeah. So, for example, thinking about childcare. And this, as I have a 5-year-old and a 15-month-old.
So you know about childcare. You're an expert in childcare.
Childcare in LA.
That's another level.
And I think about my own experience, right? Growing up, receiving childcare myself. My mother had me when she was 19, and she had very little options, right? And so for a parent who does not have the ability to pay $3,000, $2,000 a month for childcare, who doesn't have leave that they can take that is extensive or what have you, right? You have to find somewhere to place your children if you're going to keep food on the table, right? And so what that looks like for someone also who is a CSA survivor who has said, I can't be around my family because they are unsafe, because we know that most childhood sexual abuse, the child knows the person. They are often a family member or a family friend. And so if someone's like, I can't do that, what they lose out often is support. And then what that support can sometimes look like is childcare and no cost childcare, right? So if you can't afford childcare externally, you will settle for whatever you can get. And that may not be fully vetted. You may not have a whole lot of options. So then what do you do? Right? And not to say that, childcare spaces are spaces of harm on in totality, but it's the lack of ability to fully look at your options, to fully have options, no matter where you are, because you just have to go with what you need to go with.
Absolutely.
And that's often folks who are underpaid, overworked, doing double shifts, right? And so you get caught in that cycle. And then on the flip side, if you have stayed in contact with your family, if you are in relationship with them and they are somewhere where your child does go, then they are at risk potentially if that same perpetrator is there, right? So it becomes a high anxiety. Even if you find very good childcare that you have vetted, there is so much anxiety that happens for that survivor parent on letting their child be in care of someone else without them.
Absolutely, because they know what can happen. Like they acutely are aware of what the worst case scenario could be. And they also know they have to get to work, and they know that the child needs to be with some adult, right? So like this kind of just a very difficult, kind of heartbreaking decision that has to be made on a daily basis, right? And you hope everything is okay,
Yeah, you're in a bind.
Yes.
And that's part of how the system perpetuates that cycle.
Yes.
And so, part of what we're hoping to do at Cactus and Bloom is really to support people in planning, in childcare planning.
Yes.
What does that look like? When you're a first-time parent, and I know this, you don't know. I got on lists at 12 weeks pregnant.
Oh, yeah.
I'm still on some lists.
Yeah.
And they took the deposit. I haven't seen it back. But
Really?
But the thing is, you don't know.
Yes.
And so how do we support and guide parents? How do we actually vet some childcare spaces so that we can train folks and say, hey, we are aware of the cycles of childhood sexual abuse. We are aware of the signs. We are aware of how we practice consent with young children. And so let us do that and let us be known to these parents who are already anxious about it so that they know that, okay, we have some background here.
Yes. And that someone is helping them look out for their child, right? So your training that you do, that is at daycare centers, it's with medical professionals. Who else do you do training with? Do you conduct these trainings
So
with?
we're just emerging. So our hope is to definitely work with childcare centers, but also with nurses, with doctors, right? With fertility specialists. I've gone through fertility treatments to have my 2 children, and I've seen women walk out of there in tears, having just had a miscarriage, and there's no one for them to talk to. And they're about to get on the road to drive to get home. And so who is there to hold that? And so, training professionals, medical professionals in trauma-informed practices, in culturally humble practices, in somatic practices. So how do you actually, in the moment, help to regulate yourself when you feel dysregulated and then co-regulate the patient who's sitting there who might need maybe a moment in the middle of, say, a vaginal exam that might be very triggering, but it might also be like the third one that week, right? So how do you help them cope? How do you help them regulate just in a moment? And there are some quick tips and strategies that we can offer practitioners that with the residents that I have worked with, they're hungry for this information.
Yes, because they know that there is a disconnect between them and their patients, or them and their clients, and not sure of how to bridge that gap, right? And sometimes I think that people don't ask a question they don't have an answer to, right? So they might notice something seems off, or someone's, canceling their appointments, that kind of thing. But they don't know what when this person tells me what's actually happening, how am I going to look after them? How am I going to hold them in that space? And so, it kind of can sit in the room sometimes without being addressed, which also feels like, can make someone feel like they're invisible, or that their pain doesn't matter.
Yeah. And oftentimes people feel like it has to take a long time. Like it has to be, say, a therapy session.
Okay.
Or it has to be, 20 minutes to get someone to regulate. But really, it can take helping someone breathe. Right? It can take deciding, you know what, I'm going to stop in this moment, and maybe the full exam doesn't happen today. Maybe we have to take this in parts, right? To build up your ability to trust that I am a safe person for you to be in this vulnerable space with. And so strategies like that, they don't have to take long. But I think it's about teaching practitioners that actually will give you long-lasting benefits. And the outcomes, the mental health outcomes for patients will be so much better.
And I think also, Ebony, we don't also consider the benefits of that for the therapist, for the medical professional, because they are dealing with people's trauma coming up all the time, right? And so for them to learn how to take a moment to breathe, to regulate themselves, right? When they go home at the end of the day, then they have learned how to be present, how to use their tools, like not just thinking, okay, well, next person, we got to deal with the next thing. And I just heard this terrible thing from someone and this really sad story, or, like you were saying, someone just had a miscarriage, and, you can feel their sadness, and you're going on to the next person. Even for all of us, learning how to take a moment and like sit with those feelings that are coming up, and then, making space to move on to the next one. I just think it's so beneficial for everyone. Of course, for the clients, for the patients, and really, for everyone. Because even if the medical professional, the therapist, is not experiencing that themselves, there still is that trauma that's there in the room with them, you know?
Yeah, and what does it mean to take all that in all the time?
Day after day, right?
And you can become numb to it. You're like, this is just what happens, right? And so then the person who really needs that slowing down can become invisible because you've taken in so much that it's hard to sit with that. So that's so important.
It is. It is, especially if you don't think that you have the resources to deal with it when it comes up. It can really be, I think, a bit overwhelming for people sometimes. And so when you are talking to people who have experienced or survivors of childhood sexual trauma, I'm curious that when people are beginning their perinatal journey, what are the things that you see coming up for them, so that listeners can have an idea of what this might be connected to? Because I wonder if sometimes people they don't know what that connection is.
Yeah, I think it's there are a couple of things that happened, or a couple of things that are important to note. One is that with Cactus and Bloom, we're also supporting folks who've experienced sexual violence overall. And because of the fact that not everybody who has experienced childhood sexual abuse knows that that's what it was. And so
can you say more about that, Ebony?
Yeah. So there are many folks who what they experienced in childhood may not have been deemed sexual abuse.
Okay.
It may have been in some ways normalized. It also may have been blocked out.
Yes.
And so not everyone is actually actively aware, like conscious that, oh, that's what I went through. And the naming of it is also not necessarily always present for everyone.
Right.
And so in order to make sure that we're reaching folks, we know that when folks, not all the time, but there is a higher risk of when you experience childhood sexual abuse that you may experience sexual assault in adulthood. And so we want to make sure that we're catching as many people as possible so that we are making sure that we're supporting folks, right? Not just folks who can actively say, this is what I experienced, but folks who are saying, okay, well, I experienced this, and we can assess and say, okay, well, is this also something that may have happened to you that you weren't aware of? And many people are like, actually, yes, right? And so there's that correlation between that those two. To your question of not everybody is going to relate it to childhood sexual abuse. When it's in conversation, many folks may say, oh, I didn't put those two together, right? Because it was so long ago.
Yes.
And some folks have this idea in their mind of they should be over it.
Yes. I do think there is an issue of trying to speed through the healing process.
Yeah.
And I do agree that especially when it's something that happened in childhood, and if it was not named, if there was not therapy available at the time, adults willing to listen and hear and believe, then what else can you do as a person but to just kind of push it to the side? There's no space for that in my life, right? And then I imagine that you could be quite surprised when you're, oh, I'm pregnant now. Oh, something's coming up. I don't know what it is. I don't know. I don't feel the way that I thought I would feel, maybe, and that kind of comes up for people. So I think that there's a lot of reasons that people may not be able to name it, to understand it, and to work through it, right, to process it. Because if someone had told you, when you're a child, nope, that's not true, or that didn't happen, then you're like, okay, well, I'm a kid. I don't know. Maybe my memory is faulty. Maybe these things are coming up in my body or due to something else, and you can get really good at pushing that aside.
Yes, especially if someone has told you that that's not what happened.
Yes.
That's not true. And if you have family that believed that that's not true.
Yes.
So then you keep moving on, right?
Ebony, you were talking earlier about like the intergenerational legacy of sexual abuse, and when we think about like the parents or the adults who don't believe a child, right, or say that's not true, I think it's also important for us to make space that they might be doing that also to protect themselves. Because if I acknowledge this is what happened to you, I might have to go back and realize that happened to me too. And now I'm thinking about that, right? How do you work with clients when you do see that this is through the generations, this is coming up, and that's part of the suppression of this person's experience that's sitting in front of you?
Yeah, I mean, and so when it's known that it's intergenerational, it becomes clearer to the person generally that, say, I'm working with, that is aware that, okay, well, because they can, for example, tell me, oh, this is what this family member went through, and this is what this family member went through. And so then it becomes about how that affects them.
Yes.
What that means for them in relation to that family, whether or not they are connected or not to that family, but also what it means in their parenting to trust themselves.
Okay, yes,
right?
yes. Let's talk about that.
Yeah.
Talk to me about the importance of being able to trust yourself as a parent.
It's very hard. And in general, it's hard, because you're learning this new role.
Yes.
But then add on having, for many people, being raised in a situation maybe where you were not trusted, you were not believed, your truth was not deemed as true.
Yes.
And yet your body was harmed. And you have this other body that's in the world.
Yes.
And ideally you want to do differently. But it's how do you trust yourself to not be the family you came from?
Yes.
And that is one of the biggest challenges for folks, that the inner thoughts that if I could be hurt and my family could do this to me and I am of them, maybe there's something in me that can harm my own child, right? And so diaper changing can be incredibly triggering, right? Potty training.
Yes.
Very triggering. When a child is developmentally, what's developmentally typical for children to explore their own bodies and very, should be encouraged, like that's their body, that is triggering.
Yes.
Right? And so all of these moments can bring up a lot, whether or not a parent decides to shower or bathe with their child, which many people will openly, you'll see on Instagram, they're, right? It's like a thing.
Yes.
That means something very different
That's right.
to someone who is a CSA survivor, who hasn't maybe worked through some of the pieces that says that you are not necessarily an inherent harm to your child.
Yes.
And instead, you are more than likely, all of that comes from the desire to protect and to make sure that your child doesn't live what you've lived.
Yes.
And so it's helping folks work through that. Which is a unique experience.
Well, and I think that reframing that you just did of that, if the parent is feeling unsure or uncomfortable, with their child who is, exploring their body, you're doing all the things you need to do for a child, like bathe them and change diapers and that kind of thing, that is good, that is coming up for them. And it's like, now what? Because I think sometimes that we know what we don't want to be, but then we don't know what we're going to replace it with. So I might go polar opposite, and maybe that's also not what the child in front of me needs. Maybe that's not what I need. And so I think that what you're doing is giving them something to do and not just something to react to, right? You're reacting to your trauma, and so you're behaving in a different way, but it may not be the most adaptive.
Well, and the complexity of, exactly as you're speaking to, you're doing everything that you're supposed to do as a parent. Like, you are tending to the needs of that child, and yet you're conflicted with thinking that you're not, right? And then what would you replace that with? If your childhood didn't give you a whole bunch of opportunities to understand what is typical, right? Or what is healthy in a childhood dynamic, you might find questioning of if you're doing something wrong. If you're, and I'll speak to myself. For me as a parent, there is so much of double checking myself.
Tell me about that. What does that mean for you?
There's a lot of, okay, am I doing this the right way, right? Am I trusting the self, right? Making sure that I am not repeating cycles of the past and being very mindful about making choices that are about intentional parenting of now.
Yes.
And of who my children are, right? Not just of what was or what I went through because of my own childhood, right? And so that takes a lot of effort. It takes a lot of mental capacity. Sometimes it's exhausting.
Yes.
Right? So in the realm of trying to make sure that you protect your children because they are at higher risk of having the same thing happen to them, right? So it is an ongoing journey to make sure that you're trusting yourself at every interval.
Yes.
And having people around you who can check you, right? Who can honestly be like, look, maybe not so much. Let's think about this, right? As an alternative. And I have very good people around me that I trust who will always make sure that I'm protected and my children are protected. And that is the stuff that matters to me. And so, this is some of when I'm working with folks is who's your team? Who's your support?
Yes. And if you don't have that support, how do you get that?
Exactly.
Something that I'm thinking of when you're talking about how, we behave as parents and what it's in response to is how do you work with people to establish healthy boundaries, right? If I have been raised in a way and I've had experiences that told me that my body, my feelings are like for anyone and they're not for me, and I don't have a say in who comes close to me, how they touch me, I don't have a say in that. How do you work with adults to understand what healthy boundaries are and how to create those and how to communicate them to other people as well?
Yeah, and that's an ongoing journey. And it takes time. But one of the ways that I start, and it might sound silly, but I often invite folks who have a hard time saying no to say no to inanimate objects around them.
Oh, like the plant over there.
Yeah. Just say no. Right?
I
Candle.
love that.
Nope.
Yeah.
Right? Like, and what it feels like in your body to say no, because so much of this, is about bringing the body into the conversation, because the body has sometimes checked out or been overstimulated, and so also then checks out sometimes, right? And so the body is out of the conversation often because it's the site of the pain.
Yes.
So I work with folks to bring it in and to bring it in with the mind, because the majority of our information comes from our body.
Yes.
But we think it comes from here, right? So how do we get these two talking and feel the sensations of what it feels like to say no?
Yes.
And then note like what comes up for you. So that might be a homework for a week. Just say no to things, come back in, we'll talk about it.
Yes.
And we'll work through it and we'll move to that next step.
Yes.
When it comes to working with folks with their children, especially infants, about consent, like starting consent there. How to help some folks ease when it comes to even diaper changing, because how can they ask their child for consent? You can talk with your child through what you're doing.
Yes.
You can say, okay, this is what's going to happen next. This is why I'm doing this, to keep you healthy, to keep you feeling safe, and, looking that child in the eyes as you're changing their diaper as much as you can.
Yes. Yes.
Right?
Absolutely.
And offering them some soothing. And as they get older, practicing, if they say no, they don't want to hug, respecting that. They don't want to hug. And that's hard.
It's so hard.
It's so
because
hard.
Also, okay, so a couple of things that I want to share. One, when my son first started having his like infant checkups and we went to the doctor, and little, he's not talking or anything. And his doctor would say, okay, I'm going to open your diaper now because I just need to check something. Mommy's here. It's okay. He's not responding, in any way other than like giggling probably. But, and that was the first time that I've seen that done. I know that didn't happen when I was a kid. Like we didn't do that. It's like, oh, this is great because he is getting this message. I'm here. You can trust me. Here's this other person, but we're here together and just to look after you, right? And I was like, God, it was really moving to me because I think it was such a good model for something that I didn't even realize needed to be done, and I think about that all the time. My son's 8, and I still think about that. And the other thing, when you're talking about not forcing kids to give hugs, oh my goodness. I used to lead a parenting class, and it was interesting because that is the way that I parent as well, just because I want my child to be able to say, that doesn't feel good to me, and trust those instincts. You don't have to explain it. If you don't feel like giving that person a hug, you give them a high five if you want. You can just wave from across the room, like don't ignore people if it's, family, but you're not obligated to give that person. You might just not feel like it right now. And, we talked earlier about cultural humility. And I do feel like in a lot of cultures, it's a sign of respect to elders. They say, come over here, give me some sugar. Like, and you do. And I just a lot of aunts and uncles I didn't want to just because I didn't want to. It wasn't, that they were, there was anything scary about them. I just did not want to, kiss another old person in church. Right. But it was never seen as an option for me, and I'm curious about how you talk to people about that, to teach them that kids' autonomy and their bodies and their instincts and everything, that matters. And you recognize that this is something that we may not have grown up with, it even being a point of discussion. So tell me about that.
Yeah, I didn't grow up with it either. Like I grew up with exactly as you're saying. A baby's born, they get passed around. Everybody gets to get some of the hug, right? And it can be seen as a sign of disrespect culturally to not do that. So there is an active choice to be kind of on the outside of that a little bit. And I've become okay with that. And to communicate to folks about what that looks like. When my eldest was 4 months old, we went to a big family gathering. She didn't get passed around. Yeah. And I'm sure people had feelings about that. But we gave her to someone in that moment that she made eye contact with, that she was calm with, that she felt regulated with, and that she actually put her hands out.
Okay.
And so that was our sign that, okay, she was ready to go over
That's
to
her
this
consent
person.
in a way.
Yeah. And then when she was done,
She'll let you know.
Come on back, right? And so when I'm working with folks, it's kind of like I acknowledge, because I feel all the time when my kid is like, I don't want to hug.
Yeah.
You give wet kisses. I don't want that. And I'm like, okay, cool. Totally fine.
Yeah.
And I feel some way.
Yes, of course you do.
But the bigger pieces that I try to communicate to folks is, okay, so what are you teaching them? Because if we're, I believe in intentional parenting. I don't do it perfectly, but it's an ongoing process. But it's what I come back to. And so I want to be intentional in my choices. So everything I do is about what am I teaching my child? And so by saying, okay, you don't want to hug, totally fine.
Yes.
Then I'm teaching her that she deserves space, that she has a right to boundaries, and I become home to her.
That's right.
Which means that when she goes out into the world and other folks may not respect her boundaries, who does she think of?
That's right. And she knows what that feeling should be.
Exactly.
Right? You know that, no, I said something to you and you didn't hear me or you didn't respect it or, and I know that that's not the way it should be, right? The foundation that you can give your child. My son, he's put me on a limit of how many times a day I can say I love you.
Oh.
It is, or a variation of it, right? He has all kinds of rules. And he's like, Mom, you say it too much. And of course, my instinct was like, but I'm saying it because I love you so much, And of course, it's just because I love you so much. And you're so cute and I just love you. I had to have a talk with myself, And I was like, he's just telling me it's just too much for him right now. So I have 20 times a day. He keeps count, And I'm like, I respect it. I'm like, I have to get over myself and my feelings about, being your mom and think about what is this, as you're saying, what is this teaching you? What is this teaching you for your future about you're saying, here's my boundary. And these people who are supposed to look after you, are they going to respect it or are they not going to respect it? And then what do I learn from that interaction? Yeah. So I'm on my daily limit of 20.
All right. I'm sure I'm going to get there at some point.
Yeah. I'm sure. But I appreciate that my child can say that. Yes. And I didn't steamroll, what he was telling me, right? And so I think that those kinds of things that you're talking about that parents can do right now today, right? You don't have to go and study psychology or child development. You can just be like, I wish that someone had done that for me. Okay, I'm going to try doing that for my child. I wish that someone had said, yeah, I believe you, or you don't have to go over to their house, if that doesn't feel good to you. Like, we'll do something else instead, right? And just being able to do that with your child, you're just, as you're saying, changing the legacy, and giving them something new to replace it with, and the feelings that go along with that, that you matter, that you're important, that you have instincts that you can trust, right? Because we all have instincts, but then sometimes they can be pushed out of us by enough people saying like, that's not true. That's not, I don't know why you feel like that. That's your uncle. Like, it's fine. You're fine over there, right?
Yes, exactly. And when you can come back to your own body, when you can come back to what you feel is true, then it doesn't matter what friends tell you. It doesn't matter what this person says. You know it.
Yes.
And then you act off of that. And then the people who co-sign that feeling, which are hopefully like your core folks, right? And so that is what I'm trying to equip my children with. And that's what I teach clients as well, about teaching about consent, what that even looks like, and consent as a practice of respect.
Yes. And we talked about what that can look like for kids, with your child, with mine. How do you talk to adults about consent, in terms of even their interactions with other adults, right? So you have the interactions with your child. What kind of things can an adult learn in their relationships, their adult relationships, about consent?
Well, part of it is the ability for their body, for them to if they haven't already, to consciously and actively claim that they don't have to do anything with their body that they don't want to, right? And that means for themselves, they don't have to hug anybody. They don't have to kiss. They don't have to, nothing, right? And they can actually, there are some folks who are very activated by touch, by certain types of touch. Yes. And folks who are soothed by other types of touch, right? So what does it mean to learn what your body responds well to and not be okay with whatever somebody else chooses to do to your body? Because maybe it's not a practice yet of speaking up and affirming that.
Yes.
So there's so many ways that folks can practice boundaries for themselves with adults. And it's often easier for some folks if they are in the mind frame of modeling it.
Yes.
And so, okay, well, I'm going to practice this myself. Then I will be able to model it for my children. And that gives them more of a permission to do it, because some folks do need a permission to do it.
Yeah.
But what does it mean to also have boundaries around your time? Right? That's
a
huge.
lot of people have difficulty. Yes.
Yeah. Around saying no at work sometimes, because you might be overwhelmed and overstimulated, and you might be overworked. Like, what does it mean to not feel you have to take on that next thing?
Yes.
So there's so many different types of boundaries. So when I'm working with folks, it's about like, how is it showing up in your life? And what are your goals? Like, what is it that you want? Not what I want for you, because that doesn't matter. Like, what do you want? And how do we actually make that happen through practice?
Yes. Well, and you talked about the saying no to the candle or, whatever, inanimate object. And you were saying that you asked people, then, like, how does that feel for you? And like trying to reconnect the mind and the body. What kind of things do people say comes up for them when they're saying no? When we're talking low stakes, the candle's not going to talk back. You know, it's not going to insist on a yes. But what kind of things do people share with you that comes up for them?
Resistance. Like the inner kind of like tug that like it doesn't feel right. And again, it's not because the candle's going to like say anything to you.
Yes.
But it's that what comes up oftentimes is what you have experienced when you have said no, right? When as a young child, you've said no multiple times. Or maybe you were not allowed to say no. Or maybe it wasn't listened to. Or just so many different ways in which the no's of our lives are not listened to, right? Add on, gender to that, and you get a lot of women who have not been listened to. Their no's almost don't matter in the eyes of somebody else, right? And so it becomes harder to say no, because what is at risk when you say no?
Yes.
And maybe that's your safety. Maybe that's your sense of belonging.
Yeah. Or your family relationships.
Your family relationships.
Those could be at risk. Yes.
Yeah. And so there is resistance. And so what we do is we work through that. And we talk through it. And we try to move it through the body. Like, right, where is it? So there's a great exercise called pendulation that is about how do we notice and hone in on the space in our body that is active, that's like jumpy and activated. And then how do we find the place in our body that at the same time is grounded, is solid, feels like there's ease there? Because oftentimes these big feelings can take all of us over and we feel like that's all that there is, but it's not. And so we can lessen some of the activation when we can pull from the ease.
Yes.
And so I teach folks these practices. So in the moments, even though they're hard things to do, you can rely on your body to help get you to a place of regulation.
Yes. Well, and even that idea that people can recognize that you can rely on your body, right? You are not the one who betrayed you. I think that is just such a key learning for all of us, to go back to that, that is something that belongs to you. And so, it is your right to do with it as you, to meet your needs.
Yeah.
Right. To recognize what your needs are and to meet them, I think is just so valuable.
Yeah.
So thank you so much for your time. I think we've run out of time now. Is there anything else that you really want to share before we wrap up? Anything that we missed?
I think the other piece I probably would share is what is the link between a lot of this is when we have a community that is under-resourced and very much invisible in society, we don't collectively see the need to fund it. We don't see the need for research.
Yes.
We don't. So there is a huge gap in the research in terms of how many CSA survivors are even around in the U.S., right? How many are pregnant? How many are family planning? How many are parenting?
Yes.
So that then we don't have access to creating services, right? When we have such a gap in even knowing who's out there and what their needs are. And so that's some of the work that we're doing is we are trying to do the research and find what the numbers are and ask folks themselves, what are your needs? How can we support you?
Yes.
And then continue to build the supports out of that.
Well, and I think that they're giving people a voice. Like you should decide what it is that you need, right? And so even just by going to them and saying, we know that this is not already happening. Like, what would you like to see happen? Is just really powerful too, Ebony. So that's amazing work that you're doing. I'm so glad that you're in this space and and bridging this gap.
Thank you. And thank you for inviting me to talk about this. I mean, I could talk about this all day. I love this stuff, right?
No, I mean, because I think that there are things that you probably are working on every day and that come up and people don't know about, don't talk about. Maybe they don't expect to see that appear in their own lives, right? And so by you reducing the stigma, increasing the conversation, and the knowledge, it's so valuable to all of us. So thank you for the work that you do.
Thank you.
So Ebony, if people want to keep track of what you're working on, how can they find you?
Yeah, so I can be emailed at hello@cactusinbloom.org. And also we're on Instagram at cactus_in_bloom. So that's us. Feel free to reach out. And also if folks need resources, we're trying to build as many resources as possible to make sure that folks have somewhere to go and have community.
Yes, wonderful. For more information on me, you can find me at drpatricelegoy.com and on social media at Therapy with Dr. Patrice. And of course, this podcast is available on Apple Podcasts, Spotify, and YouTube. Thank you so much for listening, and I will see you next episode.